Red status. This is the buzz of Madison County, and that's the Madison County classification under the CDC's data tracker for the level of COVID virus we're in. And for some expert insight, we're turning to our voice of reason and accurate information, Administrator of the Madison County Health Department, Stephanie Mellinger. Stephanie, this past week during a meeting of the Anderson City Council, there were some concerns raised about the accessibility and availability of vaccines to protect ourselves and loved ones from the virus. So, with numbers up again, what words of advice would you have for us?
Vaccinations are 100% free, particularly through the health department. I believe that the vaccination is free. If you go anywhere else, the vaccine's provided for free. I'm not sure if physicians' offices or other providers maybe charge an office visit. However, the health department does not, and I believe that the pharmacy does not either. So my thought would be, if somebody has that barrier, please give us a call and we can try to work through it. And I don't want anyone to feel like if they want vaccinated that there is any reason why they can't be, at least for environmental or social barriers.
What kind of a demographic do we have in terms of percentage of Madison County residents that are vaccinated?
55% was last I checked, and that was last week.
I almost feel like we're not taking it serious enough now because we're fatigued by the virus. Is that an accurate take? And if so, how should we be looking at it?
I do think that's accurate. I think we are tired of it. 2 years is a long time to be trying to do the same thing of, washing hands and masking indoors and things that we didn't want to do to begin with. Things that maybe, even though we should be washing our hands frequently, maybe we're just getting numb to it, I think. What I can say about that is, thank goodness that the strain that's hitting us now is less virulent. I mean, it's way more transmissible. It's about 12 to 14 times more transmissible than any other strain. However, the disease or the illness is mild. So thank goodness for that, because we definitely don't want a repeat of what we saw with Alpha, before we even had vaccine, or Delta when people were pretty sick. So thankfully, people are just experiencing mild illness and our healthcare system isn't taxed like it was before. But I think that contributes to maybe some apathy. People aren't as sick, so therefore it's not as dire rather than it was a year ago.
Aren't we still seeing some death result from COVID?
We have had a few deaths, yes, and they have comorbidities listed on those death certificates. So we are still seeing it, yes, but it's not, we don't have very many of them lately like we did before. And I think, vaccine is a possibility, and nothing is 100%. I mean, you got to say that too. I mean, even if you're vaccinated, even if you're protecting, nothing is 100%. So we just have to do our best with all of the tools we have.
What about the mindset, I'm healthy, I don't need to worry about it, it'll just be a sniffle if I get it. But then in the back of my mind, I don't think about the fact that I'm going to go see my elderly aunt or grandmother later on.
So, conversations can take place. Hey, I'm not feeling great. Maybe I shouldn't come. And that's not just with COVID. That's any kind of illness, especially if you're going to see somebody who is elderly and maybe whose immune system is compromised. So I think that's an important conversation to have, or just being respectful of any kind of illness in the elderly, immunocompromised, and, a short-term illness like a cold. The other thing I would say to that, I think that people feel like it's not a big deal and it's just a small cold. And for most it is, yes. But then there are people who are perfectly healthy who have gone on to develop a long COVID situation. So symptoms that last long after the illness should have worked itself out. So you just don't know. You can't predict, people who are maybe fearful or mistrustful of the vaccine. That's the same response I would give them too, is you just don't know. Are you that person who could develop long-term COVID or additional health complications as a result of what most people can commonly work through a cold?
There's the school of thought that as fall and winter approach, we're going to see an even higher escalation in the infection rate.
I believe so. I believe as people come in to gather together indoors, we have less, that's more likely for transmission to occur as opposed to outside. People are closer together. I anticipate an increase in infections with school starting. And then I also anticipate as we head into the fall, October starts flu season. And so throw flu in there. We didn't have much flu the past year or so. I anticipate flu picking up again this year, more so than last.
Let's talk about, do you take walk-ins? What hours are they? What days of the week? And all of those particulars.
Monday through Friday, we are there 8 to 4. Tuesdays, however, we are there till 6. You can walk in to get vaccinated, first, second doses, boosters. Avoid 12 to 1. Typically, the nurses go to lunch from 12 to 1, but otherwise, you can walk in. We like to have somebody come in. If you're going to wait till like probably later in the day, we like it to be around 3:30 because if anybody's been vaccinated, you remember you can't leave for 15 minutes. So we try to build in that time to get you in, get your paperwork done, the vaccination administered, and then time for you to hang out for a little bit. And then keep looking or follow. We are adding a Saturday per month beginning next month, maybe even more Saturdays per month from 8 to noon. And wherever our mobile unit is, likely there's COVID vaccine available on that mobile unit. So feel free to walk up and ask for one and we'll get you fixed up.
And the location of the Madison County Health Department is?
206 East 9th Street, downtown Anderson.
So, in summary, what's the most important takeaway you'd like for us to remember?
We're considered red now from CDC data tracker, which is high transmission in our community. So just to continue those prevention measures, I know we're tired. I know we're tired of talking about it. We're tired of hearing about it. But just to protect yourself and others, continue to wash your hands, masking indoors, particularly for those who are immunocompromised. So just continue to practice prevention and stay the course, then we'll hopefully get there.
Stephanie Mellinger, thank you. Stephanie from the Madison County Health Department, working to make our community a better place to live. And that's the latest buzz in Madison County.